Well, I'm Ellen Okazaki, and I practice a healing technique called Bowenwork. And it's a relatively new technique, only been around since maybe the 1950s, out of Australia, developed by a guy named Thomas Bowen, who back in the 50s, 60s, after treating 13,000 patients on average per year, was recognized by the Australian government's health ministry department as a very legitimate and useful type of healing therapy. And he started teaching it in the late 80s, early 90s. And so it, in essence, very, very new technique compared to some of the other types of massage and other types of techniques and stuff. But with Bowenwork, it's a very gentle technique. We go over gently over the skin. It's almost just like moving skin, but gentle enough to invoke a healing response from our nervous system. And we're going over tendons and muscles and ligaments and nerve bundles. And by going gently, we are able to affect the entire nervous system. So not just muscles around joints, and we do treat joint problems of all sorts, but also visceral things, organ related. So, some of my clients come in with digestive issues. I'm always getting crampy, bloaty, gassy, and nothing I've done has been able to alleviate the discomfort that I'm in. And so Bowenwork, some of the stuff that I do, it helps to reduce those symptoms and bring comfort back to the patient. So that in terms of non-joint related, non-muscle related relief to our visceral organs, and then also the lower respiratory area, trouble breathing or congestion, upper respiratory congestion. But a lot of the folks who do come in are, they come in with specific issues like low back problems, cervical neck problems, knees. And I treat the whole age range, elderly and infirm folks to middle-aged folks who will come in and say, I never had this pain before. It's just came up all of a sudden. I don't know how it happened. To kids, high school kids, athletes, and also infants. Babies, small kids respond really, really well and quickly, because obviously they don't have a whole lot of things going on like we do. So it's just a very nice technique.
And so tell me a little bit about you and the technique and the MOA and how you got involved here.
Yeah, okay. Well, I've been doing Bowenwork for maybe about 3 or 4 years now. So I'm relatively new to the technique as well. And I got into it kind of by happenstance. I lost my corporate job due to downsizing several years ago and thought, what the heck am I ever going to do next, that I'm qualified for? But one thing led to another, and I myself got treated by a Bowen therapist and had this 20-plus year frozen shoulder relieved. I think it maybe took about 3 or 4 treatments, hour-long treatments. And, where I once had range of motion till here, I can now do backstroke, and I swim every morning. A couple of years ago, as I was trying to build my practice up, I was looking for a space in town in the university area. And somebody referred me over to the MOA office, which at the time was right in Mo'ili'ili. And that's when I met Norman Oshiro. And, I came in, I said, I'm just inquiring about whether you have any space available. And he wanted to know what I did, and one thing led to another. You know, MOA, the MOA folks, their philosophy is to be very incorporate different types of healing modalities, and so they're very integrative and very inclusive. And they brought me in right away, to my surprise. Very excited to be here. The people who come into MOA are just very nice people. The staff here is wonderful, very knowledgeable, and you know, it's just really nice, the interactions with the folks who work at the center and come through the center. People are very open-minded.